Hi, I'm Dr. Maram Hakim, talking to you from Lebanon. I'm a medical doctor and a clinical psychologist licensed in the US and in Lebanon. I want to talk to you about nature versus nurture in mental illness. Lots of debate between biological psychiatry and psychological psychiatry about the causes of mental illness. One school of thought insists that the genetic basis is the primary basis. The other school of thought is on the opposite side of the ideological spectrum, and they think that the environment basically is what causes mental illness. The truth is, it's a combination of both. What we do know is that identical twins, I'm going to say it from the beginning, I'm going to start with the core point that supports the theory that I'm going to talk about. Identical twins rarely have 100% concordance for any mental illness. For some mental illnesses, the concordance in identical twins is 30%, some 70%, some 60%, but never 100%. This fact alone, this well-known fact, medically, biologically, psychologically, this well-known fact proves that there are other causes for mental illness than just genetics. So where does this leave us concerning genetics? The theory I'm going to propose, and I'm sure someone talked about it somewhere, is that what genetics do is give us the potential to develop certain mental illnesses once the environment provides enough damage to the person at any stage of his or her life, such that there's enough trauma or enough neglect that the genes are activated for this mental illness. So in identical twins, the twin who has the mental illness, and I'm not mentioning any specific mental illness, whatever, it's OCD or schizophrenia or whatever, the twin that has the mental illness has, let's say, a gene for this. The gene is what's called methylated, it's activated, and it's activated by external factors such as birth complications, birth trauma, early trauma, later trauma, or neglect. So it's either trauma or neglect. And I'm going to talk later, not in this tape, but later I'm going to define trauma, neglect, and all this stuff. So when this gene is activated, then the illness develops. If the gene is not activated by the environmental factors, then this person will not have the mental illness and will be free of mental illness. Therefore, personally, I categorically believe that mental illness is mostly environmental, because the absence of the environmental agent will mean that the person will be free of mental illness. This is exactly the theory of epigenetics, which talks about the effects of the environment, as opposed to genetics, which says everything is in the genes and is predetermined by the genes. So basically, when the patient comes in and asks, will my kids have the same illness as myself? I say, I don't know, because it's a combination of your genes and the environment. So what you can do for yourself as a client or as a patient is to try to clear the part that's not genetic through therapy. And what you can do for your kids in the future, or just right now, starting as early as possible, even as early as conception, is to provide the right environment, so that just in case the gene is in your kids, is present in your kids, it will not be activated by the environmental noxious agents or toxic agents, and your kid might be free of mental illness. This is all I want to say for now.